Okay, thanks. Dr. Jim Carden, Executive Vice President for Clinical Integration for Hartford HealthCare. Let me begin by thanking you all for coming. We're here at the Convention Center as the military is helping set up our alternative care site in the Convention Center. This is replicating what we did in the springtime in order to meet the potential demands that our facilities become overloaded and in order to extend our capacity to be able to care for patients with COVID. These facilities are insurance policy for allow us to have additional sites of care to provide that as it goes forward. The decision to do this was a partnership between the state of Connecticut, Hartford HealthCare, as well as the military, to build out now an insurance policy that allows us to be prepared should we ever reach the point to where a facility like this would be needed. We certainly have no desire to care for patients in this facility if we can avoid it. So we will continue to strive to absolutely care for patients within the four walls of our hospitals, but this is a resource for all regional hospitals to be able to create some capacity. The folks that we'll care for here is much as the same mission we had in the spring, which is those with COVID who are stable enough to be cared for in a facility like this, generally recuperating from COVID but not yet ready to return home to a congregate living facility. They need to continue to have some care. The build-out is for 600 beds, and we will have them set up entirely by Saturday. Hartford HealthCare will then be bringing in the equipment that they need in order to manage this facility, all of the additional requirements. Before this facility be ready to take patients, we would obviously work for the DPH to get approvals that we are good to go. That is the plan forward. The need for this can be clearly mitigated if we can continue to remind each other that the more we can do with social distancing, mask wearing, washing hands, avoiding large congregations can keep the spread of this virus under control and therefore much less likely to cause overflow or put our capacity at our hospitals under stress. So I'll stop there. I'll introduce Staff Sergeant Stephen Tucker, who will address you guys and then available for questions. Stephen?
Thank you, Doctor. As Doctor said, my name is Staff Sergeant Stephen Tucker. I'm with the Connecticut National Guard here on site today. So we have a team of guardsmen assembled here from both the Connecticut Army and Air National Guard here for, as the doctor mentioned, our second buildup of this alternative care site here at the Connecticut Convention Center. The team that we have assembled here is comprised with many folks that we had here the first time around. So as you can see behind me, we got started around 9 o'clock this morning, and already we have a lot of the partitions, a lot of the beds set up in progress to get to that 600 number. Many of our members have been on active duty status on orders since the March-April timeframe, and so we've seen this alternative care site be set up and then get taken down before, and now we're here to set it up again. And that's what we're here to do throughout the response to COVID-19. We're here to provide the logistical support to the state and their mission and help support our regional care facilities with whatever that they may need as well. After the equipment was taken down the first time, we brought it back to the commodities warehouse in New Britain, and so it's kind of a repetition here, bringing it back again to make it available and make sure that everything is in place so that in the event that Hartford HealthCare or any hospital in the region should need it, we have that equipment available here, and we thank our guardsmen for helping to make that happen today. So with that, we'll take any questions.
So in April, we never had to use this facility. So no patients ever needed to be cared for in here. We certainly very much hope that that is the case again here. We really do not want to, unless we absolutely have to, care for patients in a facility like this. So our goal is to build this, to be ready, but hopefully, in my view, never have to put a patient here.
But talk about the timing of what precipitated this then. Why did you decide now is the time to do this?
Sure, and in partnership with the state, we've been watching the positivity rate of cases and understanding that following a rise in the prevalence of the virus, that's to follow that is often hospitalizations and utilization goes up. As we were working together to figure out what's the right timing, this is something we want to do before you need it because of the preparatory nature of what we need to accomplish to get this up and running. So as you saw, the rise in cases, the increase in hospitalization that are certainly occurring, and then recognizing we still have the holiday to get through where there is some potential for additional spread, the decision was made to say, let's get it stood up as that insurance policy now, before it's required or necessary.
In certain areas in California where the hospitals are full. I mean, is that a concern in this area, or we're not trending the same as these areas in California?
Yeah, right now we're doing okay. So as we look at it forward, we have various planning scenarios. You plan for the worst, the best, and then somewhere in between. And so we're very hopeful we'll remain below the level of to where we will exceed our hospital capacity. Our choice is going to be to make as much capacity in those acute facilities as we can before we overflow here. And again, this is a resource not just for Hartford HealthCare, but for all the regional hospitals as this will be available for anybody who is under duress. Our planning right now would suggest we think there's a good chance we can remain below the need to use this facility, but it certainly is not out of the realm of possibilities if our height is higher on the higher level that we would require it.
And what kind of plan, how far out do you think, are you planning this to be set up?
Sure. So certainly, post-holiday, as we get through January, we expect, if the models continue to prove, we'll start to see a tapering or at least a leveling off at that point where we can manage the volume. But we'll leave this up until we're pretty well assured that we're not at risk of bumping up against those overwhelming the facilities again. Certainly the vaccine all helps, but that's still a while in coming before it's really going to have an impact on the prevalence of this virus for now. Much more important, as I said, and I'll say it until I'm running out of gas, is mask wearing, don't congregate, wash your hands. It works, and if we do that, we're all going to be better off.
Doctor, are you working off lessons that you may have learned in the spring to make it easier this time around? And what will those lessons be?
Perfect. Yes, absolutely. We are. The good news is that an awful lot of work was done in the spring to get prepared for this, and we can bring that work forward so that. And I'll let Staff Sergeant talk to this process, which has already gone smoother, because we certainly learned lessons as we went through the build process. There's also a lot of work around managing a facility like this that we are able to just bring forward. That's why things look so similar. The use cases are similar. The people we would need to staff it, we've already figured out the training they need, the ability for the electronic health record, which is so essential to managing patients in this facility, is all set up, and we just have to sort of turn it back on. So there's a lot of things that we can do that make this a much easier lift to get started. Staff Sergeant, do you have any other comments?
Any lessons learned in Tom's question of, things are going better this time as doing this setup staging?
Right, absolutely. So as I mentioned before, this is our second time setting up this particular care site. Many of the troops that are here were involved with the first setup, as well as other setups that happen around the state, including the state universities, Western, Central, Southern. So through that experience, our guardsmen have been able to kind of set up a process as to what's going to work most efficiently to get these sites set up. So fortunately, the second time around, this is the only one that's been needed to be set up a second time so far. But, should need arise, our guardsmen remain ready. And we're just we're grateful to be involved in this, and we're grateful to help our state get through this pandemic together.
And that's
if I couldn't see what was happening behind you, just sort of describe me exactly what it is that you're doing in the process.
Exactly. So we kind of say it's almost like an IKEA bed in a box, really. So these things come off of the tractor trailers, and we open it up, and they're kind of it's almost like a bare bones kind of setup, and there's instructions inside in terms of how to set up these things. So it's really there's a base kind of foundation to it, and then there's a surface where we'll put the mattress on top of it afterwards, and then there's room for a pillow and sheets and everything like that. So it's kind of like just a more compact hospital bed in a box that we can set up, and it's very lightweight, very easy to move around and adjust to whatever the hospital may need here at the site.
And how many members of the National Guard are here doing this today?
How many, sir? 70. So we have 70 on site. Throughout the course of the pandemic, we've had as many as about 1,000 activated at the height of the pandemic. So many of our members have come on to orders either from their civilian jobs or from going to school full time. They've come in and made sure that they're here to help out the state in their time of need.
What material are the beds made of?
So it's kind of like a styrofoam, almost like the display board material that you would see for like a trifold display for a school science fair presentation almost. But the way it's put together is very good. We've had these. So these are the beds that we set up in multiple different locations, and they actually got used down at Stanford Hospital the first time around. So these have been proven to work, and they're made here in Connecticut in Basra by a Connecticut company. So it's between the company and the Connecticut National Guard working together, the resources have been available and have worked out well so far.
Speaking of resources, who pays for this? Is the state paying for 100% for the CARES Act? Where's the money come from?
So this is a partnership much like we did last time. The state is certainly bearing the cost of a lot of this setup and what we put to put the infrastructure. Hartford HealthCare, we're responsible for the cost of bringing what we're bringing to the facility and kind of managing that. So the stuff and the people and the technology to manage patients in here, medications, all that sort of thing is what we would. The state helps us. And this is not possible without a partnership with the state, and certainly the military and the professionalism and the work that they bring to this is just essential for this to all come together.
Can you give us an estimate on the total cost?
I don't. And if I had it on the top of my head, I would, but I don't know right now what it was. But it also depends on whether we end up putting patients in here. Obviously, the cost changes quite a bit as we move forward. So I don't have that number handy.
And when would you be ready to have the first patient?
So we're working through that right now. So this setup is the beginning. We anticipate we still have a couple of weeks of work to be able to get all the different pieces, to get the regulations, the drills that we need to do to make sure everybody that we passed appropriate inspections to be able to actually care for a patient in this facility. And at the present time, that is part of the reason why now, it gets to your question, this isn't something you can just turn on overnight. It's a several-week process, and we wanted to make sure we were ahead of it.
How do you deal with staffing? I mean, you got your hospital, then you got this. Is it starting to spread thin, or do you get people coming in, or who's staffing this? All just employees of the hospital?
Yeah, and it is redeployed staff from Hartford HealthCare, which would be both our nurses, support staff, and clinicians that will care for patients in this facility. And it would mean that we are taking some people out of their regular jobs because they're all pretty busy now. We understand that, but at the time where we're getting to be at this stage, it's something that we just need to have to figure out and how to do. We've been able to extend our staff in multiple places to meet the challenges of this pandemic, from testing to going to be vaccine administration, and this is just part of what we feel is our mission to supply care to the community.
How do you feel they're holding up? I mean, it's been going on for 9 or 10 months.
Yeah, it's a really important question. This has been a challenge that I think nobody could have anticipated, although it's why almost everybody goes into healthcare to meet, right? So we all know and are always called on to extend ourselves further and further. To do it at this mass scale and to see it consistently across the institution is humbling. But we do recognize that people are tired, and we have to continue to pay attention to that. As you know, most people who kind of commit to this in terms of any mission, be it military or otherwise, you dig it deeper and you know that there's an end in sight, and we see glimpses of that. Although we have to be cautious, it's still a bit of a dark tunnel before we get out of it.
And you said before, but just to make it clear, this facility is here if you need it, but hopefully you won't need it.
Correct, and I can't stress that enough. My happiest day in the end of the spring was when we never had to put a patient in here. I have the same exact wish for this facility. It's a wonderful effort that I hope we never have to use. So just as an ending, I do want to double down on the partnership and express our deep gratitude to the state for the partnership around this, and certainly the military, this is just not possible without that happening. This is not something you can do on your own, and so they've just been the constant collaboration in figuring out these problems has been very rewarding and important for us as we meet these needs. So thank you all very much.